And now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Don't you listen to what the man says.
Welcome to Boomer Life on CL 650. I'm Joanne Sutton. Thanks for being here today. So on Boomer Life right now, we're going to be talking about the latest innovations in hearing with our friends from NextGen Hearing. So joining us in the studio from NextGen Hearing is registered audiologist Dr. Ted Venema. So Ted, thanks for coming back to Boomer Life.
Hey, it's always good to come back.
Super. So on the show today, we're going to be recalling a very, very informative conversation that we recently had with a couple of experts. Two amazing surgeons, not one, but two. Dr. Brian Westerberg is an otologist specializing in the treatment of disorders of the ear. His practice is based in Vancouver. It's downtown at St. Paul's Hospital. And we also will hear from Dr. Jane Lee. She's an otologist, also based at Vancouver's St. Paul's Hospital. These two are the tops in their field, working at the BC Rotary Hearing and Balance Center at St. Paul's. So, Dr. Ted, you were actually here for that interview that day when we had them on the phone. It truly was an amazing conversation, and it's tough enough to lock down doctors of this caliber, but to get them both on the same show at the same time, wow, we're so fortunate. And we want to share that with you again. Let me ask you, Dr. Ted, what was your takeaway from that conversation we had that day?
It was good to hear straight out from people who actually do surgery on the ear. It was I usually present on the ear and hearing and this and that, but it was great to hear from two specialists who actually do surgical procedures on diseases of the ear, and of which there's many of those. And so it was just neat to hear their take on things.
And what I truly appreciated from that interview as well is how simplistic they made it. They really spoke in layman's terms. It wasn't complicated to follow. And these were surgeries that they performed on it was common to them, but on all members of the general public, right?
Yeah, it's a real skill, I think, to make difficult topics easy to understand. A lot of people don't speak in English, and it's nice to hear that, you know.
A lot of doctors don't always speak in English, but we have two of them on the show today, so let's listen in on some of the highlights from that show. Here's more of that discussion we had, starting with a question to Dr. Westerberg. What is an otologist?
So an otologist is an otolaryngologist by training. So they train 5 years to do ear, nose, and throat surgery. And then it's usually 1 or 2 years subspecialty training in just ear surgery and treating patients with disorders in and around the ear. So
an otologist is actually a surgeon?
Otologist is a surgeon.
Okay. So I was going to ask, what's the difference between an otologist and an audiologist?
So an audiologist is an expert in testing hearing. We rely on them heavily here at St. Paul's Hospital to help figure out where the problem is and how we might be able to fix it.
Yeah, that's right.
So the audiologist is basically the first person you might see other than your regular doctor. Like if you went to your doctor, I'm just trying to, paint a picture here. If you went to your own doctor and you are having hearing problems, would they refer you to an audiologist?
Could very well happen, and sometimes the person first runs into an audiologist, and maybe the audiologist refers to a physician if need be.
Okay, so it could go either way.
Yeah, an audiologist is kind of like an optometrist is for the eye, an audiologist is for the ear. So we're specialized in testing hearing, as Dr. Westerberg says, and fitting hearing aids.
Okay, so Dr. Brian Westerberg, tell us a little bit about the types of surgery that you would typically do for someone experiencing hearing loss.
It depends a little bit on what the problem is. It might be something as simple as repairing a hole in the eardrum to repairing the ear bones. There's 3 ear bones that conduct the sound from the eardrum to the inner ear. We can operate on those to reconnect them as well. Sometimes there's infections in the ear that need to be dealt with. There are some tumors in the ear that we deal with as well. In people who no longer benefit from hearing aids, the next step would be a device called a cochlear implant. We do that down here at St. Paul's as well.
So, Dr. Jane Lee, you're also a surgeon.
Yes.
And what would be one of the biggest challenges in trying to determine what type of surgery somebody with hearing loss would require?
So not everyone with hearing loss is a candidate for surgery. So the audiologist plays a really key role in determining the type of hearing loss the patient has It's also really important to examine the patient and see exactly where the problem is. Often that'll give you clues. But it's very key to figure out what type of hearing loss it is. Typically, the type will, help us determine what needs to be done.
Okay, so let's talk a little bit about the pathology of the ear. It really is quite a complicated and interconnected organ, is it not?
Yeah, it is. It's quite fascinating how much is actually going on and how quickly that signal gets transferred from the outside world into our brain, and we can process it. It's an intricate organ. It involves the outer ear, which also has the eardrum and the ear bones, and then the organ of hearing in itself is quite complicated as well. And there's nerves that travel from the organ of hearing to the brain that help process sound.
So recently in another show, I'm just going to tie this in to see if there's some kind of crazy connection here. When I was learning more about Parkinson's disease, they said one of the first signs of Parkinson's is losing your sense of smell. And I found that fascinating. I'm just wondering if there was anything with hearing loss that wasn't as obvious, other than the obvious of, you're asking someone to repeat themselves or you can't hear the TV as loud anymore. Is there anything, any other symptom of hearing loss that might surprise us?
So sometimes patients are referred that don't actually realize they have problems, but they're coming in because their friends or family members or loved ones are complaining that they're not paying attention, or they're listening to the TV loud, or they're always asking them to repeat themselves. So sometimes the patient themselves don't actually think they have an issue. No. So, signs of hearing loss can also be ringing in the ear, so that's often a first sign that there's a problem happening in the ear or a warning signal. In terms of symptoms of hearing, like first signs of hearing loss can sometimes present with tinnitus, but there are some links in terms of hearing loss and increased risk of dementia. There's no link that I am aware of with Parkinson's or that type of thing, but the ear is connected to the central nervous system, so there can be issues with processing sound if there's problems with the brain as well. And what about taste? Like a sense of taste, is that connected to your hearing at all, or? Yeah, the nerve of taste runs through the ear, but can be affected with certain diseases that involve the ear. But it's not usually a first presentation of being altered taste. So it's not something that people usually come in complaining of. It's something that is usually a problem or can be an issue after surgery with altered taste. Yeah, I can add to that by saying that by far the most common hearing loss is damage to the inner ear, or the what they call the cochlea, which is like a Greek word for snail shell. It's a tiny little area, but a snail shell area deep embedded in the bone of your skull, and it's filled with fluid and tiny hair cells. And about 95% of people with hearing loss have damage to that area. Okay. So going back to some of the research in general that's being focused on improving provision of care to patients with ear-related disorders, Dr. Brian Westerberg, can you tell us what kind of advances are taking place right now? I think we're making progress in leaps and strides in a number of different areas. The way that we can test hearing has become much more intricate. If you think of how delicate the inner ear is and the subtleties that you're able to pick up, for instance, in speech, testing somebody's hearing just by putting beeps in the ear is a fairly gross assessment. What we've come to realize is there's much better ways of testing the hearing. Much of what has been done at UBC with some of the research that's being done out there at the UBC Hearing Center. And we're trying to figure out how to get that better into clinical practice now at this stage. For instance, when you put sound into the ear will actually generate sound in response to that sound. It's not an echo, it's actually an emission. So you can actually measure those with a very sensitive microphone in the ear, and there's different ways of measuring those emissions and different variations on the theme that might tell us more information about how the inner ear is functioning. And I've just read a bit of an article about some new technology in the area of testing, something to do with an iPad. How does that work? One of our colleagues in Ottawa developed, he calls it the shoebox audiometer, meaning that you could just, reach into the shoebox and pull out everything you need to test somebody's hearing.
So it's an app for the iPad. It's calibrated. It's actually a approved medical device in Canada and FDA now, I think, too, in the United States. And what we found with it is, one, it's highly portable. You can just put it in your suitcase and carry it around with you, whereas our standard audiometers are quite a bit heavier and not so portable. It's calibrated. It's as good as doing it in a sound booth with our regular equipment as well. The other thing about it, it's a game. I was trying to test a child's hearing with it. You can do it our standard way, where you just push the button and they respond to it. But I just couldn't get this child to respond, so I just turned it around, and it's a game where the child would put their finger on a icon, and that may be, for instance, an egg. You just put your finger on the egg and hold it, and if you hear the chicken chirping inside, well, then it goes into the barn. If you don't hear anything, then it goes into the egg crate and goes to market to be sold. And it worked really well. And this child, who I couldn't get a result on, they had it done within 2 minutes. And I'm looking at it, it was an amazing display of how technology can really work well to test hearing.
Oh, that's fascinating. What a great example as well. And this would probably help the entire industry in assisting people in outlying communities and taking the testing process into areas where you've maybe never been able to access before.
Yep.
Yeah, very much so. In fact, I'll let Dr. Lee answer that one, because she's really been the driver behind the outreach stuff that we've been doing from St. Paul's.
So we've been going up, Dr. Westerberg and myself, to certain Indigenous communities that are quite remote, and it's been really helpful to have that iPad audiometer. You just need to sit in a quiet room, and you can test anyone's hearing. And arguably, we've been able to test other people, or have other people use the iPad and test with very little interaction. So it's been really quite helpful, and kids seem to really like it because it has that game element. I think it's been a game changer. We used to have to go up there. We wouldn't know if people would have hearing loss, and then we'd have to bring them all the way down into the city to have their hearing tested, and I think it's been quite beneficial.
This is Boomer Life on CL 650. I'm Joanne Sutton in studio with next-gen audiologist and teaching professional, Dr. Ted Venema. Our conversation continues with Drs. Westerberg and Lee from the BC Hearing and Balance Centre at St. Paul's, right here on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.